What is the New York State Alliance of Traumatic Brain Injury Providers?
We are an association moving toward organization, but comprised of about 40 providers, a mixture between some independent and some agencies, home health care agencies and service providers that serve the TBI population of New York. And our primary mission is really to unite the providers and to kind of form the right relationships with the Department of Health to advocate and ensure the viability of these programs long term.
What is your definition of a traumatic brain injury?
Traumatic brain injury, I mean, I guess that's a great question. Depends on who you ask. It's, from what I understand, it can be anything from a mild concussion to a serious motor vehicle accident, any trauma to the brain that does damage to any portion of it, and whether or not there's serious noticeable impairments or not.
How would one, it seems like a traumatic brain injury could be somewhat subtle. How would one know that they've had a traumatic brain injury? What would the signs be?
Yeah, that's tricky, because I think often people go undiagnosed. In fact, I think the statistics show that as well. Things like short-term memory loss, lack of concentration, impulse control. I mean, there are some signs, I think, that would point to that, but there's also many people that don't really recognize that these are symptoms of an injury they had, let's say, months ago. These things start to kind of manifest. So I think it can be really tricky, and that's one of the big issues facing, advocates for the Brain Injury Association of New York, is promoting awareness of, how subtle it can be in the people that do go undiagnosed.
Well, the one thing we hear about, and we've done shows on this before, is that many of our troops coming back from Afghanistan or Iraq, because of mine explosions or jeeps overturning or something, will come back and they'll be looking fine, and people will think they're coming back uninjured, but in reality they have these traumatic brain injuries.
Absolutely. Those blast injuries, as they call them, and a lot of, I think, recent stats are something like 20,000 current vets are coming back, again, with mild or severe brain injury. There's a great video that I believe it's the Brain Injury Association of New York State has, called the Beyond the Invisible, and it talks about I think there's 2 or 3 vets. It's almost like a documentary of their experience transitioning back into the community. But certainly, I mean, this is something that states and nationwide, I think, providers and these healthcare programs need to be mindful of, that there's this influx of our servicemen and women coming back in with these.
Who really is qualified to participate in the traumatic brain injury program that we have going on here in New York State?
Well, Joe, anyone that is between the ages of 18 and 64, there is an age kind of parameter there, that is an active Medicaid recipient. And basically what the state has done is said that this individual, must choose. They must, be willing to receive home and community-based services opposed to an institution, and they must be screened eligible, which means there's a tool, it's the patient review instrument, where someone will be basically assessed and will be determined if they would qualify for an institution. So this would be a preventative measure for the institutionalization.
Why is there the 18 to 64 demo?
I really don't know. I missed one, actually. Let me just add. And also, there needs to be a medical diagnosis of a brain injury from a physician. The 18 to 64, I really am not sure. Certainly previously the OMRDD program, and now the OPWDD, the Office for People with Developmental Disabilities, has certainly cared for individuals that were traumatic brain injury survivors, either from an infant or a birth, something that happens, an accident as a younger child, but really not eligible. So they'll kind of be in this misplaced category, if you will. Once they turn 18, we've had a lot of those individuals transition to this program. I'm not really sure about the 64. I don't really know why they set those parameters. I did mention the new program, the Nursing Home Transition and Diversion Waiver Program, which does allow for basically anyone that would be otherwise eligible for nursing home placement.
Providers that you work with in the civilian world, how first of all, when it's determined, when one personally realizes that someone they've suffered a traumatic brain injury or suspects they have, or family or friends realize that, they turn to you folks?
Not always. Sometimes, and often if that happens, I feel like we've already missed that key key connection, that key loop. They'll often, be referred to us through a discharge planner, through rehab units. There's some great organizations statewide and national that have great brain injury specific units and post-acute injury rehab units. But often it will be a phone call, word of mouth, someone calls, and then we have to kind of direct them back through the flow, through the Department of Health, through these kind of programs to see what would best suit them.
Now, your organization, which does such wonderful work, represents some 40 Medicaid waiver providers and provider agencies in New York State. Could you tell us about the folks you represent?
Absolutely. New York State is kind of segregated into 9 different regions throughout the state to serve these programs. So we have, it really varies. I mean, for example, the North Country, as they call the Adirondack region, not as many providers, not as many participants. Long Island and New York City, of course, being, almost half, I think, of both. But we are about, and I don't have the real-time stats, but I think the current participants on this program range from somewhere between 2,500 and 3,000 statewide. The providers themselves, and this is organizations, not counting all the staff that these people employ, is somewhere around the 300 range statewide. So we represent those individuals, the ones that are members of the Alliance and not, although we do welcome and want to have all providers involved in what we're doing here. But really there's some pretty obvious issues that we have really been working to develop the right relationships with the Department of Health and other organizations so that we can together find realistic approaches.
What would some of those issues be?
There's some regulatory ambiguity for starters, okay? And I think there's been a lot of discussion about, and again, I think I mentioned that this program in its inception was kind of more grassroots, and so things were really, let's get these people out of nursing homes, let's get them in the community, and as a result, some things were overlooked. Now, in years past, maybe about 5 years or so, things have really been tightened down, and appropriately so, but with the use of OMEG and other entities that are now kind of monitoring these funds much more closely as they should be, we're finding that there's kind of the he said, she said, and kind of the regulation clarity that is needed. So that's one of the things. There's also things like, again, just communication, congruency of information, the reality of applying the policies and the regulations in our society and what challenges we face, whether that be financial or just, the time frame of some of the approval periods. So.
We all know if someone breaks their leg, what kind of treatment they're going to have. If someone has a heart attack or stroke, what kind of treatment they're going to have. That's not so obvious to those of us that are not familiar with traumatic brain injuries. What is the type of treatment that is vital to these people, and also is traumatic brain injury considered a chronic illness, or is it curable?
It's not
and answer that in 10 words.
I'll do my best. Not a chronic illness. Again, curable, I don't know that applies. It is something that can be recovered from, certainly, and I think on a case-by-case basis, people have seen different, levels of growth and recovery, and some in a very short period of time, some in a very long period of time, and some it's very gradual, some it's very rapid. The care, though, the services, to your point, Joe, things like occupational therapy, physical therapy, speech therapy, the traditional therapies certainly are employed, and there's kind of a multidiscipline approach that a lot of healthcare providers are using. We come into that with case management, the personal care aides that would provide the in-home, hands-on support for these individuals, those sort of things. So the care or the services is really support services geared around how do we assist with the activities of daily living? How do we assist with some of the emotional challenges associated with, I was once a doctor and attorney, now I really can't read, and some of those emotional challenges that the survivor and the family member would face.
Oh God, that must be...
Absolutely. So these services are designed to, as best as possible, address those.
Obviously, there is the emotional support of the caregiver. And in fact, many times you hear that when someone is in the hospital, it's tougher on the family than it is the individual who's in the hospital, the care provider or the family members. How do you help them?
There are, I've come across many individuals like that, some very sad stories, and some, though, that I enjoy are the ones that begin as sad stories and end up in, the success stories where the individuals have the supports needed. And it's never easy, certainly, but there are, and more and more so, support groups for, wives, spouses, parents, and so forth of survivors. There's also, just a very real, I think, the tangible support wherein this individual was caring for the daily 24/7 needs of, let's say, their wife, and still trying to manage how am I going to stay at work and manage the household. These respite type services, these services that can come in and kind of support, and not really replace, but just kind of support the natural supports. And in the event that someone doesn't have any natural supports, can be the primary.
You eloquently answered before going on the air today. I asked you if traumatic brain injury comes under the umbrella of mental illness, and you said not really. Could you,
Sure.
for our viewers, explain the difference?
I'll do my best. Again, not a neurologist by any stretch, but mental illness is something that I think can be, the onset can be a result of many different things. Post-traumatic stress, a tragic event, there's psychosocial factors, any number of factors that can contribute to a mental illness. Certainly developmental disabilities, on and on. Whereas traumatic brain injury, again, is caused by an injury. Now, the symptoms, I think, are very easy to confuse because they actually can be the same. The depression, the impulse control, lack of concentration, and so forth. But it really is different. I mean, again, the brain injury is more of a physiological, injury that can result in psychological or cognitive, as we say, impairments or disabilities. So that's where I make the distinction. Again, definitely another big, important piece right now is to promote awareness in the dually diagnosed individuals that actually have both, and some as a result of the brain injury have developed these symptoms or vice versa. So
you said it doesn't necessarily come under the category of a chronic illness. Like about 10 years ago I broke my foot and I was in a cast for a couple of months, and then went through therapy and was back to normal, as normal as one would ever consider me. But that you were indicating that with traumatic brain injury, that can also be the case where someone can suffer from a traumatic brain injury, but like I did with my foot, completely recover?
Yes, I'm sure there are cases of that. I'm not 100% sure of when. We have, within my own experience, have seen remarkable, individuals that, the doctors are doing their job and doing a great job at it, but, this individual will never walk, talk, likely never eat solid food again, and within just a short period of time, a year, the individual is, really almost pursuing employment again. So it really, again, it varies. But certainly I think the level of, the severity of the injury, the resilience of the human body, again, on a case-by-case basis, and the support services all play a role in that. So,
what do you think is the biggest challenge facing traumatic brain injury sufferers or their families or friends right now that needs to be addressed?
In my opinion, I believe it's lack of awareness. I still do believe that we could really go much, much farther. Just had an interesting day here in Albany last week, and heard from a lot of individuals, family members, survivors, even assemblymen and women, that just still are surprised to hear that this program exists. I think, going back to your point, Joe, the subtle nature of some TBIs and the fact that I think the statistics show that, at about close to 2 million a year, Americans suffer traumatic brain injury, and about 1.3, the ones that don't result in fatalities or other, 1.3 million are released from the emergency room, and who knows where those individuals go. I think there is a tendency to kind of downplay the severity of those limitations. And so I think individuals try their hardest to go about their normal routine, and that's where you get into the societal issues where someone may be categorized as having a mental illness or a developmental disability and not. So it's really just a lack of awareness, I think, overall, that needs to we need to continue to strive to speak about the availability of these services and also about the complexity and the subtlety of TBI in general.